Do you know if you are COVID free? Get tested and find out. You can help to stop the spread of the coronavirus. Testing is free, and there are plenty of testing appointments available at our convenient COVID 19 testing locations around the island. Book online at www.gov.pm/coronavirus get tested or call the COVID 19 hotline at 444-2498 between 9 a.m. and 9 p.m. Everyone in Bermuda can help us stay COVID safe.
Thank you. Good evening, Bermuda. I'm here with you tonight as both the Premier and a fellow Bermudian who understands the frustration that we are all currently experiencing due to this latest outbreak. I see the stress and the angst that so many of you are going through. I am no different from you. Yesterday morning, I was crushed by the sight of my daughter crying, wondering why she had to quarantine and why she could not hug her daddy like she does many times a day. It is important that I express to you that I and the government that serves you are not disconnected from the difficulties that this pandemic has brought to our shores. All of us individually, whether it be the Minister of Health, myself, the Minister of Education, the Chief Medical Officer, have all had to endure personal difficulties during this time, and the impacts of this pandemic are not lost on those in leadership. We recognize that this situation, and that is why we are working hard to make the right decisions that strike the right balance at all for the entire country. Those decisions are never easy, and in leadership, they never are. But I want all persons to know that your cabinet, your members of the legislature, and Bermuda's public service are dedicated to continuing to work for all segments of Bermuda so that we emerge from this pandemic in a stronger position. You may not agree with all of our decisions, but please note that we are making the decisions that we feel are in the best collective interests of this entire country that we call home. For tonight's press conference, I'm joined by the Minister of Health, the Honorable Kim Wilson, who will provide an update on the latest testing results, vaccination statistics, and other matters from her ministry. We are also joined by the Minister of Education, the Honorable Diallo Rebane, who will provide an update regarding our public schools. Following the presentations from the ministers, I'll be discussing the recent rollback of regulations and what is needed from all of us to ensure this outbreak is not as bad or as long as the last one. And we are happy to have the Chief Medical Officer, Dr. Ayo Oyenloye, to answer any medical or technical questions from the media. First today, we will hear from our Minister of Health, the Honorable Kim Wilson. Minister?
Good afternoon, everyone. The Ministry of Health received 866 test results since the last update, and 10 were positive for COVID-19. One of the new cases is classified as imported by a resident who arrived on Delta Airlines Flight 617 from New York on the 7th of March, 2021, and tested positive on their day 14 test. 6 of the new cases are classified as local transmission with known contact, as they are associated with known cases. The additional 3 new cases are classified as under investigation. These cases are among residents with no currently identified link to other known cases or history of travel in the past 14 days. Additionally, since the last update, there were 3 recoveries. There are currently 113 active cases, of which all 113 are under public health monitoring, and none are in hospital and none are in critical care. Since March 2020, Bermuda has recorded 840 total confirmed cases of COVID-19. Out of these, 715 persons have recovered, and 12 persons, unfortunately, have passed away from COVID-19. The mean age of all confirmed positive cases is 42 years of age, with the median age being 39 years. And the age ranges from less than 1 year to greater than 100 years. The mean age of all currently active cases is 30 years, with the median age also being 30. And the ages range from less than 10 years, and that age group is between 0 and 9, to greater than 80, and that age group is between 80 and 100 years. The mean age of all deceased cases is 75 years, with the median age 77. And the ages range from less than 60, age group 50 to 59 years, to greater than 80, age group 80 to 100 years. The source of all cases is as follows: 228 are imported, 590 are classified as local transmission, of which 498 are local transmission with a known contact or source, and 92 are local transmission with an unknown contact or source, and 22 are under investigation. As investigations proceed, transmission categories may change. Of the over 180,000 test results reported, the mean age of all persons tested is 43 years, with the median age of 42, and the ages range from less than 1 year to greater than 100 years. The 7-day average of our real-time reproduction number is above 1, and Bermuda's current country status remains at sporadic cases. I will now provide an update on our vaccine program. We have completed the 10th full week of vaccinations, operating 6 days a week. For the 10-week period from the 11th of January to the 20th of March 2021, Bermuda has administered a total of 33,498 vaccinations, and that figure will rise to 34,204 if you include yesterday's vaccinations as well. All of this is very, very good news. Of the 33,498 vaccinations administered for the period we are reporting on, which ends on the 20th of March, the following is the reports. 54% of those persons are women, 46% of those persons are male. Bermuda's goal of herd immunity will be achieved when 70% of our population, which is 64,054, has been immunized. And to date, 32% of our population has been vaccinated with 1 dose, and 20% of our population has been immunized, meaning they have received both doses. 3,790 vaccinations were delivered during the week of March 14th to March 20th, and the public has access to these vaccines as follows. The vaccination center at the Bermuda College administered 20,156, or 60% of vaccinations. 12,363, or 37%, were administered at the Bermuda Hospitals Board Vaccination Center. 817, or 2%, were administered at rest homes and long-term care facilities, and 162, or less than 1%, were administered at other vaccination sites. Significant progress, has been made in vaccinating our most vulnerable. 62% of all residents over the age of 65 have had at least 1 vaccination, and 20% being fully immunized. 46% of individuals between the ages of 50 and 64 years of age have received at least 1 vaccination, and 24% of that age group have all been fully immunized. Only 13% of residents less than 17 years of age have been vaccinated, which is what we would expect, as this age group does fall within phase 3, which is now just opening up. These are excellent results so far, and I would like to thank all of those who have taken steps to get their vaccinations to protect themselves, their families, and our community. I want to remind residents that we have now entered phase 3 of Bermuda's COVID-19 vaccine allocation strategy. Phase 3 is for residents who are 16 years of age or older. Priority will continue to be given to our more vulnerable populations, including seniors and those with medical conditions. If you have not already registered, please do so by completing the registration form online at forms.gov.bm/COVID. If you were eligible for the vaccine in phases 1A, 1B, and 2, and you have not registered, I would really encourage you to do so. Registration numbers continue to rise, with more than 1,500 online registrations received since we moved to phase 3, which was announced just on Saturday. Again, to the week ending March 20th, 23,502 persons have registered their interest in getting vaccination, and the breakdown of race is as follows. 7,109 are Black, 11,438 are white, 3,323 are mixed or other, and 1,632 prefer not to say or did not specify. Please remember that you will not be vaccinated if you have traveled in the last 14 days. You must have a day 14 negative test result to get either your first or your second dose of the vaccine. Also, if you are in quarantine, please do not attend your vaccination appointments. That's important. Please let the vaccine program know that you are in quarantine and that you will miss your appointment. The appointment can be rescheduled, and if it is your second appointment, it can be rescheduled for up to 12 weeks from your first appointment. Again, if you are in quarantine, please don't attend to get your vaccination. Just call the vaccine hotline and have it rescheduled for you. Every dose of the vaccine is extremely important. So if you are unable to make your appointment, please call the hotline at 444-2498, selecting option 2, or alternatively email vaccine@gov.bm to cancel your appointment. I want to take this opportunity to remind people about being vaccinated. Again, getting vaccinated is recognized globally as one of the most simplest important measures that individuals can take to protect themselves, their loved ones, and their community. We need as many people as possible to get vaccinated. The COVID-19 vaccination will help protect you by creating an antibody response without having to experience more than mild side effects such as a headache. Thousands of people have been given a COVID-19 vaccine so far, and very few serious side effects or complications have been reported. All vaccinations are administered by trained medical staff who will monitor each person for 15 minutes after the vaccine is given. For complete, reliable information on vaccines, I invite you to visit gov.bm/vaccines. We're seeing many emerging cases of COVID-19, and this outbreak is significantly impacting children, including very young children. In fact, a full third of the current active cases are school-age children. Parents, please do not ignore symptoms and assume that sniffling, coughing, etc. is a cold or an allergy. If you or your children have flu-like symptoms, such as fevers, chills, nasal congestion, runny nose, or coughing, stay at home. Do not send your children to school, as it puts all students and staff at risk of contracting COVID-19. And just as we ask you not to send symptomatic children to school, you as a parent or the guardian should not go to work if you or someone in your household is exhibiting symptoms. In these situations, everyone in your household should remain at home. Do not have your children in extracurricular activities that are outside of their school bubble either. Speak to your doctor right away and get tested. And regarding testing, please know that there is a difference between the diagnostic testing carried out by the Ministry of Health using the nasal swabs and the saliva screening that's being carried out on behalf of the Ministry of Education by the MDL lab. If you have exposure to the virus or have symptoms, the ministry will require a nasal pharyngeal PCR test, and that has to be done, not the saliva screening. The saliva screening serves the useful purposes of providing a preliminary indication of the presence of the virus in our overall population in Bermuda. However, confirmation of the COVID-19 is provided by the nasal pharyngeal test. And I would also like to remind people who have been told to quarantine to take it seriously. The Ministry of Health's Epidemiology and Surveillance Unit will contact you if you are identified as having a risk of exposure. If you are identified as a close contact and asked to quarantine, you will be advised by the Ministry of Health's Epidemiology and Surveillance Unit. You will be told when and how to quarantine and the testing protocols to follow. Your test will be different from that of the traveling test guidance because the risks are different. Please also only follow the quarantine and testing advice given to you by the Epidemiology and Surveillance Unit. And it is essential to note that when it comes to households with multiple siblings, if you are able to quarantine the affected sibling away from the other siblings and parent, the non-affected sibling may still attend school. The other parent can go to work. If you are not able to keep the household members apart because, for example, you all share the same bathroom, or you eat together in the kitchen, or you watch TV in the same TV room, then both siblings should quarantine and the parent should not attend work. And you can find detailed quarantine information on gov.bm/coronavirus. If you are immunized and receive notification that your child must quarantine, the main caregiver, whether immunized or not, must also quarantine with the child. This is because the peer reviewed studies have not yet confirmed whether or not an immunized person who can still test positive can transmit the disease. Please note that just because persons have been quarantined, this doesn't mean that they are carrying the virus. The person may have had a potential exposure to someone who is confirmed as having tested positive for the virus that causes the COVID disease. They may or may not go on to test positive themselves. It is also important for employers to have as much flexibility as possible in these situations. Parents who are required to quarantine and not at all, and not at all able to work from home. It is very stressful on top of coping with the potential COVID-19 exposure to worry about your employment. And in closing, I will remind everyone that from the very start, this government has put measures in place to reduce the spread of this virus, flatten the curve, and not overwhelm our healthcare system. Yes, some of the restrictions are strict, but they worked. We had a strategy that achieved good results, and we were able to reduce the spread, reopen businesses, go back to school, and reopen our borders to give our economy a much needed boost. Then last November, we had a second wave, and again, we introduced restrictions intended to prevent the spread of the virus, keep people well, save lives, and protect our already fragile economy. The restrictions that were put in place and people following the guidance we provided worked, and we were able to once again ease the restrictions. However, just as we thought we were turning the corner in our fight against COVID-19, we find ourselves rolling back the relaxations again to protect the health and well-being of our community from another outbreak. We will get through this current challenge, and I'm grateful to all of those dedicated healthcare professionals who are working tirelessly to fight this pandemic and keep us all safe. This last year has not been easy, and we have learned some important lessons along the way. And 3 points that I would like to make this evening are as follows. One, we must follow the guidance and obey the restrictions that are in place. This current variant spreads very, very easily and very, very quickly, as we are seeing. Two, we must be patient. This pandemic is far from over. And three, the more people that get vaccinated, the better chance we have of reducing the spread and get our lives back to some semblance of normal. I know people are frustrated with all of the restrictions, especially the curfew. However, we have empirical evidence that the curfew is working. Having people stay at home and having controls that prevent socializing outside of your household helps to control the spread. Socializing outside of the household that you live in and having people socialize in your home, and this is outside of the members of your household, has presented the problems that we are now seeing. We urge everyone to reduce the bubble of people they socialize with to just their household. This will help stop the spread. Please remember that the government's actions are designed to protect our residents' safety and well-being, to ensure that our healthcare system does not get overwhelmed, and to protect our economy. Thank you.
Thank you, Minister. And thank you to you and your team who are again at the forefront of leading and guiding us in how we contain this outbreak. I know how exhausted you and the team are, and Bermuda is grateful for the long hours, weekends, and holidays that you have given to this fight against the pandemic. Bermuda is fortunate to have such a dedicated set of public officers working despite the senseless actions of a few people who certainly should know better. The number of active cases is alarming, and it is essential that we take responsibility for our everyday actions to ensure that we can bring these numbers down rather than see them continue to increase. This is public schools, where, as the Minister of Health indicated, the outbreak has affected many families, including my own. We will now hear from the Minister of Education, who will provide an update on our public schools. Minister?
Good evening, Bermuda. As a parent of a child in the public school system, I am well aware of the anxiety our parents are facing. It was very difficult for me to explain to my daughter how the nasal pharyngeal test works and how all of her schoolmates at Whitney Institute was to be tested last week. Thankfully, her and her schoolmates all returned negative results. The decision made today was a very difficult one. I truly believe that our children deserve to be inside of our school buildings. However, this afternoon, I issued a media statement addressing the proactive measures underway to ensure the health and safety of our Bermuda Public School teachers, students, parents, and the larger community. Bermuda, the ministry, and the Department of Education, and myself understand the anxiety and alarm is heightened due to the recent positive cases. I can assure you that it is of paramount importance to the Ministry of Education that we are transparent with our COVID-19 protocols we have in place. However, any decision that impacts our ability to educate our children is one that is not taken lightly. In light of the recent rise in positive COVID-19 cases on the island, the Ministry of Education will implement the following: Easter break 2021. The Easter break will commence on Monday, March 29th, instead of Thursday, April 1st. The last day of school for students will be Friday, March 26th. Students will return to school as normal on April 12th. We acknowledge that the rise in positive cases has disrupted our staffing levels as a result of teachers being ordered to quarantine during contact tracing. With this in mind, and out of caution, we have decided to move forward proactively. Schools will be asked to send out learning packets for students to work on during the 4 days next week. We also plan to hold discussions with our union partners about the possibilities of how we can make up those 4 days. Our senior schools, effective Wednesday, March 24th, tomorrow, will be allowed to transition to remote learning, while senior school teachers will be allowed to report to school and conduct classes virtually from their classrooms. The previously scheduled professional development workshops for teachers will still take place on April 1st. I've also been made aware of professional development that was to be conducted this week being unable to go forward for various reasons. Hopefully, these professional development sessions can still take place next week. In the statement issued on Sunday, the government informed the public that additional information will be released on schools once further details are known. I can report the following. Northlands Primary. The entire school, except for those ordered to quarantine, was tested on March 19th. And out of the 102 tests performed, 2 returned positive. The Department of Health determined the movements of one or more of the positive individuals within multiple school bubbles made it possible for wide exposure in the school on or before March 19th. Out of an abundance of caution, the decision was made to transition to remote learning while students and staff were required to quarantine until April 2nd. At Purvis, a similar situation. The entire school, except those ordered to quarantine, was tested on March 20th. And out of the 138 saliva samples taken, there were 0 positive cases. However, when the initial exposure cases, close contacts were tested, 4 additional positive cases were identified. The Department of Health has determined that the movements of one of these positive cases within multiple bubbles at the school also made it possible for wider exposure. wider exposure that may have happened at the school on or before March 16th. Therefore, a decision was made to transition to remote learning while students and staff must quarantine until March 30th. This weekend at Elliott Primary School, the chief medical officer directed all students and associated students with one P4 class to be quarantined. Students and the teachers in the P4 class were tested on March 22nd and will be retested using nasal pharyngeal swabs again or on or after the day 14 test, which falls on March 31st. The entire school, 99 casual contacts, were tested on Monday, March 22nd, as part of the new testing protocol announced last week using saliva testing for casual contacts once a positive COVID case has been confirmed in the school. West Pembroke, this past weekend, as with Elliott Primary, the chief medical officer had directed all students and associated teachers of the P6 classes to be quarantined. The students and teachers of the P6 class were tested today, March 23rd, and will be retested again on or after the day 14 quarantine, which falls on April 1st. The entire school, 117 casual contacts, were tested today, as per the new testing protocol I previously announced. In summary, in addition to the above, we have classes that are currently quarantining at Devonshire Preschool and Whitney Institute, and as of yesterday, Delwood Middle School has been put on full quarantine. Given the data that we have received, the ministry is taking a proactive approach to balance what's best for our students' learning and our island's health and safety. Bermuda, I remind you that the vulnerable must be protected. That means we must all be considerate of how exposure to COVID-19 affects students, schools, teachers, parents, and the larger community. Well, based on the risk assessments that have been done, we have seen our bubbles work effectively. However, I want to remind parents to check with your doctor if your child is experiencing any signs of sickness and do not send them to school. The additional time over Easter break will be used to further refine our COVID-19 protocols within school buildings. We intend to return after the Easter break with a renewed vigor to ensure our children are served as they should. We ask anyone who has children, family, or friends associated with the school system to use caution and strictly adhere to the government's safety measures to help us contain this latest outbreak and reduce the transmission of COVID-19. We must all work together. Wear your mask correctly, wash your hands regularly, maintain physical distance, and get immunized when you can. Before I close, I wish to take this opportunity to thank the Department of Health and the Bermuda Government Molecular Diagnostic Laboratory for their dedication and commitment to ensure the safety of our schools. Thank you.
Thank you, Minister of Education, and thanks certainly to your team for your rigorous work, especially over the last few weeks, to keep our schools open and students and teachers and parents safe. I know the decision to ask students, teachers, and staff to quarantine is never taken lightly. And I know that also the decision to have an early Easter break and extend it from 1 week to 2 weeks, or I should say from 6.5 days to 10 days, is not preferable. But I understand the circumstances which are presented, and I'm gratified that the new protocols that have been implemented by the Ministry of Education and the constant communication and better clarity which is coming out by the ministry have kept our parents, students, and teachers better informed. And I want to also thank the chief medical officer for revising the protocols which have allowed our schools to remain open as long as they have. Majority of our schools are not impacted, but we are making sure we take precautionary measures with the new saliva screening method to ensure that parents and can have peace of mind, and students and teachers can also have peace of mind. On Saturday, the cabinet met to discuss how the government should respond to this current outbreak. Due to the increasing numbers and the reality that we are dealing with a highly contagious UK variant, it was decided to roll back the regulations to where they were in December 2020. Like so many of you, I'm disappointed that we must take these steps after making so much progress together. However, we must act immediately and purposefully to prevent this current outbreak from getting worse. The restrictions that we put in place worked in December, and they will work this time. And this time, we have implemented them more quickly than we did the last time. For example, on December 11th, when the last set of restrictions that we have went into place, Bermuda had 149 active cases, of which 45 of those were under investigation. This time around, at the time of implementing the measures that were put in place, we had 91 active cases with 12 cases under investigation, and that was on Sunday. One of the things in which we're seeing inside of this outbreak is that a lot of the cases that are coming are part of previously identified clusters. Therefore, there are less people that are under investigation, and there are confirmed contacts due to the aggressive quarantine action and testing action that has been taken by the Ministry of Health. And it's important to know that quicker implementation of restrictions leads to shorter times that those restrictions must be in place. And the purpose of restrictions is to ensure that our healthcare system does not get overwhelmed. Now, there are persons who say, well, there's no one in hospital, so why do we have these restrictions in place if the objective is not to overwhelm the healthcare system? I have two answers to that. The first answer is we do not wait until the ICU fills up until we start putting restrictions in place, because at that point in time, you are far too late. The second item is that we have to remember that our healthcare system is not just our hospital. Our healthcare system is our public health infrastructure. The nurses, the doctors, the swabbers, the people who are doing the vaccines, the contact tracers, all that support work. If they get overwhelmed, that means that our public health efforts and the work of which we are doing to make sure that we can vaccinate our population falls down. So I don't want people to focus purely on the number of people being hospitalized. Our healthcare system is not just the people in hospital. It is all the teams that are involved in the public health apparatus. And it is important that we protect them, especially after they have been battling this pandemic for a year. As a reminder, the public health regulations recommended by the Ministry of Health and agreed by the Cabinet, which came into effect on 6 a.m. on Saturday, March 21st, are as follows. Curfew now begins at 11 p.m. and will continue to end at 5 a.m. Clubs and bars are prohibited from serving patrons indoors, and outdoor service is for table service only, no seating at the bar. Restaurants, bars, and clubs are permitted a maximum of 6 persons per table. All personal services, including spas, beauty salons, and barbershops, staff, and customers are required to wear masks at all times. Gyms must ensure that patrons remain at least 10 feet apart if they are not part of the same household, and the maximum size for gathering has been reduced from 25 to 10 persons. Indoor church services and ceremonies are limited to 20% of the venue's capacity, and outdoor funerals are permitted to be attended by up to 20 persons, and the boat curfew remains at 8 p.m. The government also recommends that staff who can work from home should do so. The government is again committed to supporting workers and businesses affected by the revised and necessary regulations. The Ministry of Finance has renewed the unemployment benefit support for individual workers, and payments up to a maximum of $500 per week will be paid next week. The aim is to speed the payment so that persons eligible will receive the full $1,500 for the full 3-week closure, and those payments, as been indicated by the Ministry of Finance, will be paid no later than early next week. Applications can be filed starting tomorrow at uba.gov.bm. And for persons who would have received benefits last time around, the process will be quick and simple for verification. Businesses that are affected will again be eligible for grants to cover expenses and overheads through the Bermuda Economic Development Corporation, just as they were in December. If you are a qualifying business, you can apply for the COVID Emergency Relief Grant funding by going online to bedc.bm. and those would be for the businesses that have been affected by the closure orders. These restrictions will remain in place for at least 3 weeks and will be reviewed by the cabinet in hopes that we can begin to safely ease them when our active case numbers have decreased. We never implement these measures lightly, and this time is no different. We understand that this has been a long and tiring battle for all of us. There is no question that it has been difficult, and there is no question that it has been a strain on all of our personal health and our mental health. However, we are making progress. And I think that is key for us to recognize and understand. We are making progress. We are not where we were in December. 39% of our eligible population, those are those persons aged 16 or over, have received at least one shot of the vaccine. This is a key point. And we have maintained and expanded our testing capacity to make sure that we can better respond to outbreaks. Yes, this outbreak, like the previous one, was a result of selfish actions of a few. However, it is important that I continue to applaud the overwhelming majority of Bermudians who are quite simply doing the right thing. So many of you have continued to abide by the rules, follow the guidelines, and do all you can to assist the country in its performance. The current laws and enforcement in place to deal with offenses in COVID-19 regulations are substantial. However, as with all offenses, the judicial process can take time. Any perceived delay in persons being brought before the court is not uncommon. However, as Assistant Commissioner of Police Martin Weeks did acknowledge 2 weeks ago, there is a backlog of cases being sent over to the DPP and a backlog within the courts. But that does not mean that persons are not being held accountable for the violations of rules of which they've had. Bermuda's courts are still hearing cases for other serious offenses, and COVID-19 breaches are now all a part of those to be heard. Persons who break the law will be brought before the courts, as some have already, not just visitors, but locals, people who have put on parties that were legally hosted, etc. Those have been through the courts, so I do not want the impression that enforcement is not taking place. The government has previously advised that fixed penalties were being considered. And I can advise today the cabinet agreed to those fixed penalties, which will now be brought to the House of Assembly to be considered in the legislature. However, as I mentioned, the change does not mean that penalties do not exist. They currently do. And the public health COVID-19 emergency power regulations state that people who violate the offenses for their first offense are eligible for a fine up to $6,000, and for a second or subsequent offense, a fine of up to $10,000 or imprisonment for a term not exceeding 3 months. There are penalties in place, and the impression that there are not penalties in place is not correct, and I want to make sure that the public understands that it is not correct. The change, as I said, does not mean that penalties do not exist, and they currently do. And persons are subject to significant fines and possible imprisonment. It is not correct to say that there are no penalties in place. There are in place. What fixed penalties will do will make it more quick and efficient, like a speeding ticket. But that does not mean that people who have broken the rules prior to the implementation of fixed penalties will not appear before the courts, as some have already, as I've indicated, for breaking the rules. Ultimately, our vaccination program is our most effective weapon in ultimately defeating the virus. I'm delighted that we have moved to phase 3, which enables all persons 16 or over to register their interest in getting vaccinated. And I encourage all persons over the age of 16 to register and sign up. As a country, we set an aggressive target of administering 38,000 doses by the end of March. And at our current rate of vaccinations, we will meet that aggressive target that was set. And I want to commend the entire vaccination team for their efforts. As mentioned by the Minister of Health, we've administered 34,204 doses of the vaccine thus far, and Bermuda maintains its place among the top countries in the world for vaccinations administered relative to population size. The government also projects that as the current rate of vaccinations continues, and the rates of which we've been able to keep, which is between 4,300 and 4,700 a week, averaging around 4,500, and with the commencement of phase 3, we will see approximately 50% of the eligible population, that is, persons that are over the age of 16, who will receive both doses or 2 doses of the vaccine by May 1st. And as it continues at the current pace, we can reach 70% of the eligible population of Bermuda, that is, those persons who are over the age of 16, will have received both doses by June 1st, if we continue at the pace at which we are. But the only way we do that is if you go online and register. Having the majority of our population vaccinated for the virus gives the virus nowhere to go, and it reduces transmission, which is significant. It is at this point that we can hope to truly begin a return to normal and significantly reduce restrictions. However, we must give ourselves time we need to reach these goals by containing the spread and continuing to follow guidelines and regulations. I know that there are some who feel that this is endless. And as I expressed earlier today, I recognize the impact that this has taken on our emotional well being and our mental health. I get it. It is painful for all of us. But the one thing that I want to leave us with today is to recognize that it is not forever. There is a way out of this, and I am gratified that there are so many persons who are taking advantage of registering for the vaccinations and going ahead and being a part of what is ultimately going to be required to end the transmission of this virus. Many of the people involved in the contact tracing case management are the same individuals involved in the vaccination program. And whenever there is an outbreak, the staff of the Ministry of Health, who are already stretched and stressed, are further pressed into service to help manage people who have been confirmed positive. This is why it is extremely important that everyone who is contacted by contact tracers give their full support by providing the information quickly and promptly. You are helping to identify others who are potentially exposed and possibly saving the lives of those in society who are most vulnerable. And I have to repeat this again. Information that is given in a public health context is never shared in an enforcement context. If you are contacted by a contact tracer and you said, I was doing this, this, and this, that is not going to be written up and passed over to the police. That is not the way that these things work. It is important when we recognize that public health is there and privacy, and there is this wall which sometimes frustrates us, but is necessary for public health to be effective. Cooperate with the contact tracers, because if we do not, we have a longer road to go, and that is important. We have not only made progress in vaccinations, but certainly how we respond to the outbreak. And thanks to effective contact tracing and also the We Health app, we can better and quickly isolate positive cases and known contacts. The public can continue to help this by ensuring you have downloaded the We Health app to your phone. Just the simple installation of this app on your phone will help to contribute to our effort to shorten this outbreak and avoid future outbreaks. And I cannot state how critical this is. This, combined with fully cooperating with contact tracers, is essential to get through this outbreak. The We Health app does not hold your personal details, and if you are provided with a code to enter into the app due to testing positive, please make sure you enter that code so you can alert your friends and anyone who you may have been close to. Any information given to contact tracers is confidential, so please be honest with them. As I close, I want to say that it is important for us collectively to honor our frontline health professionals who have worked tirelessly over the past year by playing our part to contain the spread of this new variant of the coronavirus. We can end this outbreak. The government has acted more quickly. We have proven that if we take our actions, we can move things back to a state of normalcy, but it is up to all of us. And I ask you to recognize that your friends who may be breaking the rules are putting us all at risk and are part of the challenge which we're dealing with. And so I ask us all to try to make sure that we accept personal responsibility and collective responsibility and talk to our friends and talk to our families and make sure that we get through this. You would have seen announcements today about how we are planning for the future, what we want the summer to look like, whether it's cruise ships returning to put people at work, whether it's making sure that we enhance our protections at the border by implementing additional quarantine requirements for non-vaccinated travelers. We are moving forward towards the future. This is a small blip where we are right now, and it is unfortunate that this has happened. But I do not want us to lose faith and hope that this will get better. Please continue to do your part. Wear your mask, wash and sanitize your hands, maintain physical distancing, adhere to the regulations. If you are sick, stay home. Go get tested. Call the hotline if you're symptomatic. Go and get tested. There are the resources that are there to combat this pandemic, but we require the cooperation of all of the members of the public. A few times in this speech, I've mentioned how the pandemic has taken a severe emotional and mental toll on so many of us. If you need some support and someone to talk to, the emotional well-being hotline is there, and the phone number is 543-1111. Again, 543-1111, and it's open Saturday from 5 p.m. until 9 p.m. With that, that concludes my remarks, and I'm happy to take questions from members of the media on behalf of the people of Bermuda at this time.
Good evening, Trevor Lindsay, TNN News. Premier, I will direct my first question to you.
Keep that mask on.
Okay. First question to you. You have indicated, and this is coming from teachers that are watching, teachers from Northlands and other schools that are watching. You've indicated your daughter goes to the Northlands Elementary School, and teachers and everyone has to quarantine. Why are you not quarantining with your family or your daughter? One. And two, if you've been immunized, why is it that you can't hug your daughter?
Number one, I follow the public health advice. The public health advice says that you must be separate inside of your house. So I think that the separate one has answered your first question. As the minister has outlined the public health advice, the chief medical officer issued a press statement yesterday. And in that vein, that is the reason why I'm here. We obey, listen, and follow public health advice. When individuals are on protective quarantine, it is not that they're on isolation. When someone is on isolation, that means an entire household is quarantined. When persons on protective quarantine, if you're able to maintain separation inside of your house and able to do that, as the guidance has been put out from the Ministry of Health in December, and now persons are able to leave their homes and do things as normal. It's difficult. It's very difficult, but that's the reality. And I have a relatively important job to do. My daughter kind of doesn't understand it. She yesterday morning, she said something like, "But Daddy, you said that people can work from home. How come you're not working from home?" I don't understand. And that's the challenge. But the things are there. The rules are there in place. And those are the rules that are being followed.
Thank you. I don't know, this is for the health minister or the CMO. How can you give a number to how many children, specific number to how many children have tested positive for this latest outbreak?
It's approximately 1/3. 1/3 of the active cases are all children.
And another question for the CMO. Do you encourage, and I gave you a little heads up to this one, CMO, do you encourage testing for all members of our community? Testing is free. How important in controlling this complete uh, coronavirus to our economy?
Absolutely, you're spot on, Trevor. It's important to test as much as you can. And tests whenever you have been exposed or you need to. I don't know. The premier has mentioned some time ago. If you want to go out for the weekend, then you should have ideally should get tested on Thursday before you go out. That's one way you can do it. If you it's a good idea to put a testing regime in place for yourself and for your friends, and that gives you the assurance. I must also emphasize though that testing only gives you a snapshot of that point in time. So if you have been exposed or been asked by the ESU team to quarantine, testing at that point in time does not indicate your future risk. So please follow the advice that you've been given.
There seems to be a high degree of advertising for vaccinations.
Yes.
Why has there not been the same level of advertising for testing for those that might not get the vaccine?
Well, first of all, everybody should get the vaccine unless you have allergy to any of the vaccine components or you are aged um, 16 or under. Everybody should get the vaccination. But regards to tests, you would recollect that prior to us having the vaccine on island, this was the primary message that we're promoting. Um, Obviously, for obvious reasons, we need to promote the vaccination because that's the fastest way to get us to some form of normality.
Thank you. Premier, economic question. I'm not sure if you can ask, but TNN understands that there are a high volume, and I've been told some 12 families that have come into difficulty with their mortgage shortfall and have lost their property. Has your government been in contact with the banks to work a solution that could be a win-win for everyone involved?
There was a conversation that was held earlier today with the Minister of Finance, who has responsibility for banking. There's issues that were happening. The Speaker of the House raised one particular issue of his constituent who, was a tenant in a home, and the home was repossessed. And that person, of course, has been doing their part, and it's a challenge with how that's affected. But the Minister of Finance there was a conversation with the Minister of Finance about those particular matters today, and those are things that need to be addressed. And so I believe that there will be a meeting with Bermuda Banks Association, because some of the actions which are taking place, especially in situations like that, show no form of compassion in the situation which we're in. And I would say that where banks are reporting profits, there's also a responsibility inside the public sphere to ensure that you're doing what is necessary to maintain social cohesion. So from that impact, I certainly recognize, I appreciate the question, and there will be some further remarks on that, because the actions which we're seeing are not in keeping with the spirit of community that we should have.
Thank you. What number am I on? One more. Okay, so I'll take this one. Minister of Education, you give indications of many schools, but you omitted P4 and P6 from Pedger Primary that is still quarantined. There's nothing in your statement from today indicated that would comfort that particular school. Why is that?
There is nothing more to update on Paget Primary than what we had reported previously.
So they must just stay in quarantine then.
Yes, they whoever's in quarantine at Paget would have received their individual letters that would state that they are to be in quarantine, and it would also list the date that the quarantine would end.
Thank you much.
Good evening, Don Burgess, Bermuda Broadcasting. CMO, just for since the last time we had a surge, we've had a lot of people that have now vaccinated. Can you explain what the differences are or situational for them with regard to quarantining and what extra comfort they may feel from being vaccinated?
Right. I think your question, the underlying sentiment to your question is the difference between what we're doing on island to what CDC recommends. And I've explained in the past that there is a difference in the country status of Bermuda as compared to what is happening in the United States. There is established community transmission in most parts of the United States. So, on the balance of risk, they can afford to say, well, we can give a couple of liberties that we can't afford to do on island because we don't have community transmission. I would like to keep it that way. So going back to your original question, if you've been vaccinated, unfortunately, if you still have an exposure, we would require you to quarantine. And in this instance, it's not only for yourself. It's more about protecting the vulnerable people on island. And there are so many of our vulnerable population that still has not been vaccinated. We cannot afford them to get infected. And that's the reason for the quarantine measures that we have for vaccinated people. But it might interest you to know that a quarter of our new active cases at the moment are asymptomatic, and quite a few of we found that in our amongst the active cases now, we do have a couple of people who've had their vaccinations, but still tested positive. But fortunately for us, the trend we're seeing is that they tend to either be asymptomatic or have very mild symptoms.
Okay. Just to follow that up, 1/3 of the cases are children. So, what differences do they experience compared to adults, or are the symptoms the same?
It's okay. I'll answer that question in this way. The typical signs of COVID we're all familiar with that: flu-like symptoms, fever, loss of taste or smell, and then cough. You do find that with this new variant that is predominant on island. However, what we have been finding is that the predominant um, presentation for symptomatic people is what people would associate with allergies. So a bit of stuffy nose, a bit of runny nose, um, occasional cough, not so much of fever, not so much of loss of taste. So that's slightly different from what we have seen, and that's particularly pronounced with children. You expect children at this time of the year to have runny nose and the likes, and it's very easy to miss. And goes back to the point made by the minister. If your children or yourself are experiencing any of these symptoms, please do get tested.
Okay. And one more for you.
Go
Uh,
on.
Given the current active cases and the current makeup of the cases, statistically speaking, is it probable that more people are going to die from COVID due to the recent surge? And are you expecting this surge to continue over the coming weeks, or do you believe we are reaching the peak?
Touch wood. We're not going to get any more deaths. And this is not just being this is not just wishful thinking. I think because of the work that has been done with vaccination, um, and the better understanding of how this virus behaves, I think we are seeing more and more of our vulnerable people protected from this. Having said that, though, over the last day or two, we're seeing older people testing positive to this virus. And you and I know that statistically speaking, these are the group that are more likely to end up needing hospital care and probably dying. So it's not say never, but I'm hopeful that we would not have the kind of outcomes we had with the last outbreaks.
Okay. Thank you very much.
Thank
Mr. Premier, I can imagine how difficult it must be for you to be isolated from your daughter. For other parents listening tonight, can you advise them how you and your wife explain this to your children? And do
Um,
you have any advice for other parents and children going through this?
I'm not going to be able to give you the best answer for that because when I my explanation powers are not that good because yesterday morning it ended in tearing, crying outbursts of my daughter, which also kind of brought me to tears as well. So unfortunately, my wife isn't at the press conference, so she can't speak about how she's managed to explain it to the children. But they had a better day today than they had yesterday. Yesterday, there was still a lot of crying and lack of understanding, etc. And it is a challenging, certainly a challenging situation, which is being faced. And it's unfortunate because, as the chief medical officer may have intimated and the minister has stated, a lot of these things could have been preventable if people just literally stayed home while sick. And the minister of education has, understood that there are certainly some protocols that need to be tied up. People who have symptoms should not be going into classrooms in the first place. And there's certainly a little bit of work that needs to be done there. But as one of my friends said when he asked me yesterday how I was doing, he said that children are resilient, and they are, but we have to also recognize their emotional well-being, and so it's a difficult balance. So they had some fun. For me, it is difficult, certainly, as my daughter and I are very close, and every day there's multiple hugs a day and different things. So it's just a different situation. But my experience is no different than many parents inside the country. And I think that the experience that I have, recognize the impact that it has on myself, helps me to be able to make decisions that are in the vein, recognizing of the impacts of which they have on many families in this country.
Thank you. Just to follow up from last week, you mentioned you were to meet with the governor. Are you able to share any of your discussions, in particular, with how many more vaccines we might be receiving in the coming months?
I do have a meeting next week. We did have a meeting last week of where I particularly shared my concern. One of the things that I'm very careful of is not to disclose the nature of the conversations in which I have with Her Excellency the Governor, as those are private audiences. But what I will state is the fact that we have expanded our vaccination program to phase three. We are looking at to secure additional vaccine shipments. We have an aggressive target. You would have heard me inside of my statements that if the pace that we are currently at continues by June 1st, we can have 70% of the eligible population, those are 16 and over, having at least one dose of the vaccine. And if that's our pace that we're setting, and as long as we have the registrations and people that are willing to get the vaccines will keep on coming. And that's the pledge that the United Kingdom government has made to their territories. And we are fortunate to have that pledge, and we're going to continue to press this. That is the way in which we will be able to return to normalcy. And that's the way. One of the things the chief medical officer spoke about was the issues of, how we're going to move. There is certainly going to be further considerations which we're going to have to take on where we're going to go and how things will be different for those persons who have been vaccinated and those who are not. And we're going to continue to work through that process. Where we are right now is not ideal because we want more people to be vaccinated, but we recognize the science, we recognize the place in which we're trying to be. And as we move forward, there may be more, I would say, freedom. And if freedom is not having to quarantine after being exposed or certain things, that'll certainly be a benefit. But we're going to continue pushing ahead with this. And I would encourage people to get registered because we will have the supply for anyone who wants the vaccine in this country.
Okay. My last question, and don't want to leave the health minister out, although she may refer to the CMO. Um, have we been able to genetically sequence the COVID positive cases in the latest outbreak? And if yes, have the latest outbreaks been traced back specifically to the mid-February Smith Parish House party and/or specifically to the March 6th party at the Horticultural Hall?
I know the answer, but I'll yield to the CMO.
Okay. So we do have, fortunate to have ability on island to be able to tweak our PCR testing processes and be able to identify viruses of concern. So there are four viruses of concern that we are able to pick up on our PCR template now, which is the work that is being done, fantastic work being done by the MDL laboratory. So that gives us a good picture of where we think we are. And obviously, before you can get to the level of molecular fingerprinting, you need to have full sequencing. That is still on its way. We don't have that yet, but what we have is good enough for the epidemiologic work that we're doing. And to answer your question, 80% of the active cases we're dealing with on island are of the virus of concern that originally first detected in the United Kingdom. So that, what at the moment we don't have enough to be able to do the fingerprinting that can tie to a single person.
Okay. So it can't be linked to either of those two events then at this time.
We could make very strong suggestions that it may be, but at this point in time, because we don't have the fingerprinting, we can't really say it is definitely associated with those two events.
Okay. So the strong suggestions would
It's the
state
same
what the-
strain.
Okay, it's the same strain. Okay.
Yes.
All right. Thank you.
Good afternoon, Owen Johnson Barnes, Royal Gazette. While we have the CMO up, I might as well keep him. I don't know if this will be for you or the minister. To start off with, in some places around the world, we have seen cases of a long COVID where all of a sudden, not all of a sudden, but people have continuing lingering effects. Have we had any cases of that in Bermuda?
That question probably needs to go to my clinical colleagues in the hospital. We don't primarily deal with that, so I won't be able to answer that question.
All right. And second of all, the vaccination rate for those who are over the age of 65 was at 62% now, I believe was said earlier today. Given this is now 10 weeks into the vaccination period, I personally had expected it to be somewhat higher. Has there been a degree of an increased likelihood of people not being able to take the vaccine when they're of a certain age? Or is this another issue of vaccine hesitancy amongst our seniors?
I think it's mainly the issues that we've had is mainly been that of vaccine hesitancy. We started off quite slow. Technical difficulties, as you expect for a program of this size at the start of the program, but we picked up very rapidly. But we can only vaccinate the people who come forward to be vaccinated. And to be fair, there's been anecdotal evidence of a shift in public perception about vaccination, and we hope that this continues to get to the level where we can be confident that as a society, any infection that comes in goes to a dead end.
Oh, that's good to hear. Next question.
If I just may just add to that
Go for
very briefly, because the CMO is being polite. We have seen a reduction in vaccine hesitancy, and it is showing. And what I think is also important is that the Ministry of Health has also opened walk-ins for vaccinations to reduce the barriers. And those walk-ins continue, and people can go to Bermuda College after the hour of 3:30 if they're 50 and plus, and they can go ahead and get a walk-in appointment. And that is something you reduce the barriers, and that has been able. We've seen senior citizens go in, we've seen disabled persons go in, we've seen other persons. We hear the stories that they show up and they say there's a line, and then the person at the vaccination center says it'll be 3 hours. We're a little bit backed up because so many people showed up, and those persons say we will wait. And so expanding access and reducing the obstacles, we'll see that continuing to increase. So, but I think that it's important that though we might want to talk about, it's important that we vaccinate the most vulnerable population. I think that it is something to celebrate, that we set an incredibly aggressive target. And through the work of the Minister of Health and Chief Medical Officer and their teams, we have met it. We are going to meet that target of having 36% of the eligible population, 38,000 doses given by the end of this month. And that is actually incredible. So, I think we should celebrate the successes while at the same point in time, we look at things that we can get better. They will get better. But as well as we are doing is certainly something that we should be proud of.
My next question will be to the Minister of Education. As we have heard, 1/3 of the new cases are of school-aged children. Given this recent outbreak, do you believe that perhaps this action may have come too late? Is the genie out of the bottle?
Actually, no, I do not. As I mentioned within my statement, and the risk assessments that are done within our schools show that the bubbles are working, and that's how we're able to isolate a class. When you talk about 1/3 of the active cases, and the active cases now stand at about, well, what's that? 113. You talk about a third. That's 33 students out of 40 out of 4,400 within our system. And so when you look at it from that perspective, I wouldn't say the genie's out of the bottle. I would say that our teachers and our educators, our leaders within our school have done a tremendous job of adhering to the protocols and enforcing the bubbles within our school system, and has allowed us to actually have much more control than what we've had than that other countries many times our size have even been able to imagine having.
And look at the examples the minister went through in his statement, said the fact. Because remember, we were in December, shut down the entire school for a single case. The chief medical officer, the Ministry of Education, worked through revised protocols that we put in place to manage outbreaks of schools, reinforce the bubbling concept, and we can see by and large those bubbles are working. We can see that where we have a number of cases that are limited in a certain place, but when you test the entire population is not coming up positive on screen. So that's important for us to note, and it's important to recognize. No, it's not going to be perfect. Yes, it is impacted, as I had mentioned before, by individuals who are going to school when they should not be going to schools, or going to classrooms when they should not be. But by and large, the protocols of which we've implemented are working. And once we tighten them up and adjust, I'm sure they'll be even better. They were better in March, they were in December, and they'll be better in April than they were in March.
Next question is a little bit of a clarification request. You mentioned that senior schools will be allowed to transition to remote learning effective tomorrow. Can you explain what that means? I mean, is it going to be the teachers deciding whether they're going to be holding classes virtually? Is it going to be the parents deciding whether to send their kids in?
No, I guess that's a bit of a misnomer. The senior schools will transition. How the senior schools are working now, they have a hybrid system where the S4s and the S3s are working remotely, but they attend school on a regular basis every couple of days. So what we've allowed is for the entire school to go on the remote, the entire two senior schools. Both of them demonstrated with what's going on in our community and people on quarantine. Both of them demonstrated 20 plus missing staff just today alone. And so when it starts to get that high, it's very difficult to operate the school as you know, and keep people on the straight and narrow and do all of those types of things. So we've allowed them to go or remote. But with the other schools, because the bubbles are much more stricter at the primary and the middle school level, we want them to remain in school until Friday, and then they'll go into Easter break.
Thank you for that clarification.
Sure.
Next will be for the Premier. You mentioned the stress being handled by the frontline workers in the healthcare industry, particularly. Dr. Weldon posted recently on Twitter that she had worked 361 days without a day off. Can you say what the government is doing to sort of offer these people some sort of break, some sort of relief? I mean,
Yes.
obviously, working 363 days now in a row is not going to be very good for them.
I would say that it's not, but that's where a lot of us have been. But I think we also encourage people to take a break when necessary. And so that's important. But the way that we get breaks is by, if we care about the people on the front line, and you saw how I ended my speech, talking about honoring the people on the front line. The people on the front line are only responding to what's taking place inside the community. That's it. And it is a difficult and delicate balance of which we are going at. But we have to certainly be mindful that the people on the front line are there to respond and to protect us. And if the actions of the people on the front line are the ones that are determinant on how much work the people on the front line have, it's the actions of the wider community. It's unfortunate, Owen, that a vast majority of people in this country are following the rules, a significantly vast majority. But it's only, as we see in this case and instance, a small amount of people that can cause such a very large challenge. And it's unfortunate.
Now, how frustrating is that for you? And not only as a premier, but as a father who can't hug his daughter right now, to have people going and doing obvious breaches. I mean, there's talk of a protest taking place tomorrow. How does that feel?
Um, I am about 4 years into this job now, and nothing surprises me anymore. And so I think that what we are focused on is focused on doing the work. We're focused on continuing getting better. We're focused on continuing to improve. We have done really well on testing. We've done really well on vaccinations. As our vaccinations improve and there's more access to vaccines in our main gateway cities, the United Kingdom and the United States, there'll be stricter controls at our border. And we will be reintroducing mandatory quarantine for non-vaccinated passengers. And we're going to continue that increase. And so it's a difficult, delicate balance that we have. And that's why I started my speech. We have to balance all things. We have to manage the local economy, the international economy. We have to manage education, seniors, young people. All those things is what we balance. And the decision which we make, certain people in one segment may think that this is not okay. Certain people in other segments will think it's the best thing since sliced bread. And we just have to make sure that we're doing that balance. So from my perspective, nothing surprises us. We are focused and dedicated on the work. You've seen the tireless efforts of the Minister of Health. You've seen the tireless efforts of ministers of the government. You've seen the tireless efforts of all members of the legislature working inside their communities, doing their efforts, and the ending efforts of the heroes, our frontline public officers, our doctors and our nurses who are doing so much in our community. So we're going to press on, and we press on not in hope. We press on knowing, based on science, that this will come to an end. And as long as we keep up what it is that we're doing, we see that that light is at the end of the tunnel. Current rates of vaccinations, as they are, 70% of the eligible population by June 1st will have received 2 doses. That is something that we aim to get to, and that is something that gives us hope as we continue to push through.
Thank you very much.
Can I just clarify something, Owen, about the walk-ins, and the Premier indicated about the walk-ins, because you know that we did offer the walk-ins at the Bermuda College. This week, we are not doing walk-ins. We'll make an announcement as to when we're going to resume that again, because you may recall a couple of weeks ago, there was an abundance of vaccines, and we opened. Those persons have to get their second doses this week, in addition to the ones that have already made appointments. So it's a temporary pause, but I'll be making an announcement as to when we'll be resuming that again.
Thank you very much.
Thank you.
Thank you for that clarification, Minister. Don't want people showing up to get walk-ins, and those walk-ins are not available.
Good evening, everyone. Maya Palacio here for Media Mile. My first question, I'm actually just going to piggyback off of the World Gazette there, is do you, Honorable Premier and Honorable Minister, have any words for the persons who plan to attend the peaceful protest tomorrow at 10:30 p.m. and plan to stay past curfew?
It's very difficult for an anonymous protest to be given permission. And I sincerely hope that anyone who wishes to do that and recognizes that they may be in violation of laws and there may be consequences for it.
Okay, thank you, Minister. Okay. My second question, how many days after the second dose of Pfizer is a person fully immunized?
A person's fully immunized 14 days after the prescribed dosage. So, for example, Pfizer, it's 2. If it's the Johnson & Johnson's 1, so it's 14 days after you have the prescribed dosage.
Thank you very much.
Mhm.
I guess my third question, which is also a follow-up question to that one, there is, I've had a community member who reached out to me saying that it's not clearly stated that it's 14 days, and when they traveled back home, they had to pay the fine, I believe, because they didn't know it was 14 days. I thought after they got their second dose, they're fully immunized. So can that be clearly stated on the government traveling page for the Pfizer that it must be 14 days after?
I'm not 100% what you're saying. Sure what you're saying, because there is no fine for somebody that's
Sorry.
not immunized.
Not fine, but I think I could be incorrect in saying this person is either a resident or not, but I believe they are a resident and they didn't get the pre-departure, but still came.
I think you're.
I might be confusing.
Yeah,
It's
I
not
think
on
you're.
my phone
Yeah,
anymore,
I
so
think
I'm
you're
sorry.
mixing two issues, because there is no fine for a person that enters Bermuda that's not immunized.
Not for not being immunized. It's a $300 one for.
Oh, for not having a pre-test.
Yes,
Right.
not having a pre-test.
Right.
That,
Residents
yeah.
of Bermuda that arrive in Bermuda that do not have a pre-test are still required to pay the sum of $300 because of their not having a pre-test.
Okay.
And then they test on arrival. So that $300 is as a result of not having a pre-arrival test.
Mhm. Even if you're fully.
Shorten the period of quarantine upon arrival from the mandatory 8 days to 4 days. And I think that's the revision. However, as the Minister of Health says, that amount is for individuals who do not have a pretest.
So even if you are fully immunized, 14 days after having you fully immunized and you travel back to Bermuda, you still have to have a pre-negative COVID test. You still have to get tested.
If you don't want to pay $200.
Yes. Okay. Thank you
Yes,
very
you
much.
don't have to have one as a resident, but that is not determinant. We want people to get tested before they get on planes. That is what we want.
Okay. Thank you.
And it is cheaper to get tested than it is to pay the $300 upon arrival.
Thank you very much. My fourth question, I believe, is: have any of the positive cases we've had been fully immunized persons?
I'll let the CMO add, and it's too bad he's already answered that, but that still counts as 4.
Okay. I missed it.
Yes, that we have had a handful of cases. I don't have the numbers with me now that have been immunized and still tested positive. But as I also emphasize, what we found in these cases is that they're either asymptomatic or have very mild symptoms.
Okay. I will have a follow-up, but I'm not going to use it. Sorry. So,
No problem.
okay.
But I think it's important to recognize that that is not abnormal. And I think that people will mistake and sometimes even take it from me, who I said something one day and then got messages from Dr. Wellman afterwards like, that's not correct. That's not correct. Having a vaccine does not stop you from getting an infection. You can still, it stops you from getting sick and, possibly reduces the possibility to transmit the virus, et cetera. But those are other things to be done. But I think it's important to recognize that that is not abnormal. That does not mean that the vaccines do not work. That does not mean that the vaccines are fake. That does not mean that this is all a scam. No, that is what happens. But if a wide variety of the population gets vaccinated, then the reduction in transmission is less and the end of things disappear. And seeing I know that you're a fan of Twitter, I know that a whole lot of people were talking about chickenpox yesterday. Vaccines work.
Okay. Thank you very much for answering my follow-up question.
No problem.
I try to ask them for clarity. So
I wanted to, I knew where you were going to go, so I was ready for you.
thank you very much, Premier. My fifth question is: yes, those who are working from home, they want to know if government will make it mandatory to work from home, because some people want to work from home, but their bosses are telling them that they have to come into work.
It's
Is that under
you wanna answer that?
consideration to make it mandatory to
Right.
work from home?
The recommendations, because of where we are, is that persons are encouraged, strongly encouraged, to work from home and work remotely if they are able to do so.
Thank you very much. And my last question, so as I asked for the night, is: Bermuda once had a 14-day mandatory quarantine. Will government be bringing that back into place, especially considering today someone tested positive on the 14th day?
You want me to answer that? I'm happy to answer that question. Sorry? Oh, I'm happy to answer that question. So the issue about quarantine at our borders is something that a lot of persons will recognize. And so unlike other countries, we have a very strict testing regime at our borders. But it relies on individuals, especially after day 8, to make sure that they're doing the things. And we have visual identifiers so people can know whether or not someone is at risk and someone has recently tested. The decision to not implement mandatory 14-day quarantine on arrival is taken, as I said at the very beginning, at the balance of our entire economy. Mandatory 14-day quarantine on arrival, whether or not paid at own expense, et cetera, will decimate our hotel industry and will cause our hotels to close, putting more people out of work. That is a fact. We know that. We understand that. What we have done is that we put the balance in place with an aggressive testing regime and precautions. However, what is key is when there is the place where vaccinations are freely and readily available in our main gateway cities in the United States, where the President of the United States has said vaccines will be available by May, and in other places such as the United Kingdom, where we know we had to get a lot of our visitors as well, it is very likely that by the summer, there will be the reimposition of a mandatory quarantine for arriving passengers who are not vaccinated, because that is the only way to prevent the constant circle and cycle, in my view. But the thing is that we have to balance all things as we're doing right now. That is the reason why we have the restrictions in place. That are reasons why we're standing up our vaccination program. But it is important that we recognize that there are so many people inside of our hotel industry who depend on travel, who depend on business travel, who depend on ensuring that the borders are open for those items, etc. The last thing we want to do is to lose air flights. We want to lose access. What's it called? It is a difficult. So I recognize that there's a lot of people who are concerned about this, but the truth is that as we move forward, and these are conversation discussions that have already been held preliminary with the Ministry of Health, with Bermuda Tourism Authority, and others, there will be the reimposition of mandatory quarantine upon arrival for those persons who are not vaccinated. And that will mean that people need to be vaccinated. You will see the announcement that the Minister of Transport gave in the House of Assembly on Monday, and the announcement that came out from Royal Caribbean today regarding choosing Bermuda as a place for home porting. Every single one of those persons will be required to be vaccinated upon arrival. And that's not until June, but that's the direction in which we are going to be going and heading for our tourism industry. It is the only way that we're going to make sure that we can maintain safety inside of our country. And that is the way that we can make sure that our hotels are full, that people are still doing things, that the people who did not get to work last summer in the tourism industry can return back to work. And the only way we're going to preserve things long term is if we re-implement those restrictions. And when their vaccines are freely available in our gateway cities, that will happen. And those discussions are already in place. So certainly.
Thank you very much.
No problem, Mr. Palacio. Is that it?
Thank you, Premier and Ministers, for your attendance,
All
as
right.
well as the CMO.
No
Members
problem.
of the media, thank you as well.
Can I
That is
close?
the end of the press conference.
Thank you. Let me close for a second.
Oh.
It's Michael's first time. He's okay. I certainly want to thank all who attended today. I will leave you with reminders that we've had. It is up to all of us to do what is necessary and required to combat this pandemic. And I would ask that we follow the restrictions that are in place. They were imposed earlier this time than they were in the last time that we saw a surge in cases. And if we all do our part, this can be a much shorter imposition of restrictions. And I want to remind everyone that if you're above the age of 16, you can register for your vaccine. Please ensure that you do so. Thank you, Bermuda, and good night.